Welcome to the Tapestry of Life. I am Dr. Pascal Scholes, Professor of Behavioral Health and Human Services at Community College of Philadelphia. Today's topic is mental health challenges in college. According to the 2014 annual report by the Center for Collegiate Mental Health, increasing numbers of college students in the U.S. are wrestling with self-injury and suicidal thoughts. Thousands of counselors nationwide found the top 5 concerns of students listed in descending order to be feelings of anxiety, depression, relationship problems, stress, and finally, academic performance. To discuss this topic today, I want to welcome back my co-host, Renee Norris-Jones, and my 2 very special guests, Marcia Hilary, I think it's pronounced. Hilaire, okay. A graduate of Community College, and Keisha Lagoa, who's also a graduate of Community College. So we have mental health at Community College of Philadelphia in the sense of part of our topic. Well, maybe we can get started by saying, I for many years directed the behavioral health program, and in that program, many of the students, and there's about 630 of them, many of the students who come here come because of challenges that they had either in addictions or in mental health. And so I'm very familiar at least with a subpopulation of people, but I know both of you were not in the behavioral health program. You were in what I call the general college population, if I'm not mistaken. So today's show, we're kind of interested in just getting a sense of what it was like and how life was for you. I don't know if you want to start. When did you first come to college?
Well, I graduated from high school in 2009, okay. But I did go through a weird period where I didn't know exactly what direction I was heading, or I still had like anxiety about school, and going to school to me was kind of like I had to make it here, like I had to make it in school or I would be a failure. So that gave me a lot of anxiety. So when I first started coming to CCP, I wasn't like the best student. I don't know, I was still struggling with depression, and coming out of high school, it was just like something, like a new chapter of my life.
Did you go to high school in Philadelphia?
Yeah.
Which high school was it?
Franklin Learning Center. Oh, okay. Yeah.
And were you depressed in high school also, would you say?
Yeah, I actually started seeing a therapist when I was a freshman in high school.
Oh. Now, out of curiosity, was it identified through the school system, and was that the way you kind of got identified, or were you just on your own?
No, actually, my mom was the one who she kind of like put me in therapy and that sort of thing. Yeah. I was very quiet, and she thought it might help if I talk to someone.
Sure.
Right, and that was the question I was going to ask when you started therapy. Was it just starting high school, which can be a traumatic experience in itself, or you said it was your mom who saw you maybe a little introverted?
Yeah, it was more like, because I was a good student in high school. I was always, I loved school. Like, it was just one of those things, like I loved going to school. I didn't like to be absent. Like,
right, okay.
But my mom did want me to come out of my shell a little bit, and I don't know.
So when you were in high school, and you were not out of your shell, as you say, were there did you have a lot of friends in high school, or were you pretty much considered like alone or isolated in high school, or were there other people who shared the same thoughts that you had that you became friendly with? And I'm trying to just get an idea of what makes it different for you as opposed to other students who were in the school system.
Yeah, I mean, when I first started high school, I was a little more isolated, but as I got to know more people, I did have just a few friends. It wasn't nothing like wasn't like, I didn't have like a lot of friends, but you know, I had a few friends.
Sure.
I didn't think it was as strange or anything.
Oh, okay.
Like,
so you didn't feel odd
yeah,
that you were
didn't.
kind
I
of
didn't.
in a certain way of dealing with high school.
So you mentioned that, so in high school, you liked school, you liked going to school, the grades were good.
Yeah.
And then you said when you got to college, the grades were not as so good. Was there a transition that kind of happened there?
I feel like once I started seeing a therapist, that was kind of what
Helped you?
not helped me necessarily, but it kind of made me start rebelling in high school, during high school. I don't know. I'm not sure if that was, you know, I'm not sure if I was going to go through that stage regardless, whether I saw a therapist or not, or...
Whether you were just a stinky teenager.
Yeah, I mean, because
So your therapist helped you rebel?
I'm not...
I'm just joking.
No, I'm not sure.
Because I was a therapist for many years, and I guess
Yeah.
you could look at when working with people, that what you do is when you bring them forward, so to speak, it is like a rebellion of some sorts, in the sense that you're now taking increasingly more responsibility, you're acting differently than you were before, you're more your own person, I guess, some of those things.
Yeah.
Yeah? No?
Yeah,
Maybe?
yeah, maybe.
A lot of
Yeah,
people
it's
who get depressed, you know, in the field when we think of depression, one of the things that kind of haunts a lot of therapists is the fear of suicidal ideation and those kinds of. Did they appear in your life when you were in high school and college, and how was that handled, if you don't mind me asking?
No, to be honest, I don't know, like, I never really had these thoughts of suicidal before I started seeing a therapist, if that makes sense. And I don't know, like, in the situation where, you know, you're in a room with a therapist and that sort of thing, I was constantly like, am I good enough to be sitting here talking to this therapist? Like, am I wasting his time? Because I don't feel like there's something wrong with me, but maybe there is. You know, there was always this, I don't know. It was
the fear that you don't deserve to be there talking to him?
Yeah.
Or him, was it him or her? I don't know.
It was a him.
Him,
yeah.
okay.
But I don't know. I don't know if that was part of my own. I'm not sure.
Well, that's an interesting twist, because normally when people come into therapy, there's an expectation that there's something you need to work on, and that you both have some kind of mutual understanding that the therapist can be helpful to you, so to speak. So, but I rarely. It's an interesting twist when you say that you didn't know whether you deserved to be there talking to them.
Yeah.
It was just kind of.
So, right, so I heard the word, I know you said your mom sent you to therapy. And so it sounds like at that point you were okay with going to therapy, or were you kind of unsure?
I was okay with it. I just, you know, I was unsure of what I was going to get out of it.
Okay. Right, because you said deserve, and I didn't know whether you meant deserve or whether you meant whether this is something that I needed, or whether I deserved it.
I think both.
Okay.
I think
when you say both, you mean you thought you needed it and...
Well...
You questioned whether you needed it or deserved it.
Yeah.
Okay.
Well, partly, I suspect that part of that was that your mother wanted you to go, and it wasn't out of your own wish. Right. It was more you were being pressured to go, and that's pretty common among adolescents. If a parent sees a difficult situation, they say, well, maybe you need to talk to someone. And I guess you say, well, it's my mother, and maybe she knows better, or whatever. I don't know if you were very close to your mother. Some people are close to their mothers, and some people are not.
Right.
But it sounds like you went into therapy for a couple years, I remember we were talking earlier.
Yeah, a couple years. And I've been in and out of different therapists, so I've seen different therapists as well. Okay. And I was on antidepressants.
Okay. Which ones were you on, just out of curiosity?
Prozac, Zoloft, Celexa.
So they felt that your depression, was this when you were in college this was occurring, or were you in high school?
I was still in high school.
You're still in high school.
When I was taking
So they thought it was serious enough, the therapist, that a psychiatrist had to bring some medication to bear, which is with depression, that's a fairly common thought, that people will bring medication to bear.
Is it common for high school students?
Well, see, that's why I hesitated when I said it, because they have a tendency in this culture, you know, my doctorate is not in medicine, so, but they have a tendency in this culture, when in doubt, medicate,
right.
And instead of doing more behavioral issues and, you know, behavioral management issues, and which take a little longer to work on, sometimes they mask it or cure it by changing the, you know, the neurostructure in your brain, so to speak. Yeah. So some of that happens, but it is a frightening phenomena, I believe, that's going on, in the sense that a lot of medications being given to high school.
And as a parent, I can even imagine my child in that situation. And I mean, as a consumer now, my doctor knows what else can I do besides the medication. But as a parent, that's a totally different animal. The doctor says she needs medication. I'm not going to probably challenge them. You're saying that there's something there, and you're helpless because you're not a medical professional. So for someone to say this medication is going to help, you're going to sign off and say, let's do it, whatever she needs to get there.
Well, what's interesting, and it would be interesting to hear, and I know I want to hear your story too in a second, we'll get to it, but what's interesting is that when they told you they were going to medicate you, how did that make you feel? There's a whole group of stuff about that.
Yeah, because that made me feel like there's something wrong with me.
Yeah, see, that's
and that goes back to what you said in reference to, you said a lot of these behaviors didn't unearth themselves until after you started therapy. Yeah. So it seems like therapy, its goal is to help kind of uncover some things. Yeah. But for things to come out that weren't there beforehand, so was that therapy, or was that medication?
Well, the whole, and again, it's partly my personal bias as a former, I used to do a lot of therapy at one time, is that I've often thought over the years that what we try to do over time is either through medication and through certain behavioral strategies, that we want the person to be able to manage their life better, with the expectation that medication will become not the major issue in their life, but the minor issue in their life, because they're managing their life much better. Right. And that at least is a goal that we often think about. Now again, I'm not, my doctorate's in clinical social work, so I have a tendency to think of more like a community process involved in person's recovery, et cetera. And I'm not antagonistic towards people using meds, but I'm saying, you were on medication for how long? Are you still on medication now?
No, when I got to college, that's kind of when I decided I stopped seeing therapists, I stopped medication, I was just off everything psychological, psychiatric, like I just stopped.
Well, I'd like to get back to it. How about, I don't want to ignore our other guests here. Does some of this make sense to you?
Yeah, I actually saw Marsha when Keishla first started talking. I saw Marsha doing that. That's
nodding appropriately, as they say. Does it make sense to you? Can you?
Yeah, some of it does, but like I feel kind of, you know, I kind of relate to her, but as far as like, you know, going through high school and stuff like that, I was like really isolated. Like I felt different. Like I felt like, you know, because I never really fit in when I was in high school or middle school. So it was like I always felt like something was different.
Not right.
About,
something was not right.
Yeah.
And have you felt that most of your life?
Mm-hmm.
Oh. Do you still feel that way now? Kind of? No?
I've come into the idea that my bipolar is not me. I'm bipolar, but I can't let it like dictate my life and stuff like that. Like when I start getting those thoughts, like the hardest thing is knowing when it's the disease, or like if it's the illness or if it's really me. You know, like when you're thinking and stuff like that, you're wondering, it's just like, is this me thinking or is it the illness? So it's like really hard to separate who you really are from what you're going through in the illness, because you don't know if it's you know, if what you're going through is legit, or if it's something going on in your head that's not right.
Yeah.
But it seems like that's a big step to be able to step back and say, is this me? Is this the illness? Versus being totally under the illness where you're not even able to step back and see, what is this?
Yeah. And I would, you know, this might sound odd to say it this way, but it's all you. And it's okay. It's all you. Your voices are you. Your mood's you. And you have to take ownership of it. That's what at least that's what we say sometimes when we're talking to people. Take ownership of it and manage all of those. I used to say, people who hear voices when I used to see them, they say, well, you know, nobody wants to talk to me because I tell them all about my voices. I said, well, right now what you need to do is restrict your voices and just tell me about your voices. Because a lot of people don't understand voices, you know, they assume that if you hear voices, there's something really weird with you, you know, like, and you are different. But what I don't want you to do is to give the impression that you're weird. See? So you are bipolar. You could hear voices. You could be all of those things. But that's you. And you almost have to kind of manage you in life, which I'm sure you could relate to that also. And you get the impression sometimes when just hearing you talk that you almost feel that maybe this is me and this is not me, and why can't I figure out what's me?
Right.
And
like separating my identity from the bipolar disorder. You know, like they say one of the symptoms of bipolar disorder is having this grand, how do you put it, like this thought that you can, that you
the
can
mania
do
side of it.
Yeah, and sometimes I feel like that, and it's like, is it wrong to feel like that? And you know, knowing that, you know, that's one of the symptoms is like, instead of feeling like, okay, I am great and this is what I really feel, is like, do I think this way because I'm going through a manic episode? You know, instead of feeling like, okay, I just feel like, you know, my self-esteem is up there today. Like, I feel like, you know, I could conquer the world today, you know. And when I feel like that, it's like, is that really coming from me, or is that coming from the bipolar?
Sure.
You know?
Yeah.
And is that where therapy will come in to help
therapy
to
will help
manage
that? You in therapy now?
Yeah.
Yeah. Is your therapist talking to you about those kinds of issues?
Well, actually, I've been in therapy, but like what happened was my first therapist got fired, and then I got a second therapist, and he got a new job. So I stopped seeing a therapist. I haven't seen one for a couple months now.
Yeah.
But because it was just like, you know, having to reopen up with a whole, you know, like
a whole new start.
Yeah.
A whole new start.
Like,
and that's a problem when you lose your therapist. And I remember talking earlier about the situation. You know what's interesting about bipolar? It's the highs and the lows. You know, there's the mania, and, you know, they used to call it the old manic depressive disorder at one point in time. And in therapy, what you try to do is you try to get the moods to be more normal or manageable. And so what it tends to look like, it goes like this. Your highs are not as highs, and your lows are not as low. But people who are bipolar sometimes like the mania. You know, they like that sense of being high without doing any drugs, for example.
And be feeling invincible.
And feeling that way. So if you're beginning to become aware of that, that's a good thing.
It sounds like it.
Yeah, it sounds like a good thing.
And totally from a layperson's point of view, it seems like it. And I'm a survivor of domestic violence, as everyone knows. And when I talk to other people who are kind of freshly out of that or just realizing it, it's really hard for them to say, I am a victim or I was a victim, because we don't want to put these labels on ourselves. But one of the most empowering things for me to do was to say, this is part of my landscape.
Yeah, and that's what it is for you.
Everything that I do. This happened 35 years ago, and it still colors my personality, covers everything that I do, and I take ownership of it. I think I mentioned that I just went through a training and I was down for 10 days afterwards. I accept that as part of it, and it helps me to see this is not what's going on. Yeah. You're having an experience because of something else. So that makes me feel better. When I recently found out that trauma changes the brain, I was like, that explains a whole bunch of stuff about me. But it was actually kind of, this is not just me, there's some other things that are happening. And we're not all these cookie cutter kind of people, whether people talk about it or not. And that's why this platform is so important, to add a voice and to say for other people who are going through what both of you are going through or have gone through, to say, hey, I relate to that same thing.
Well, you see, your story is a bipolar story. That's not your story, though. You could tell just by the way you started out. So your depression is probably more traditional depression, right? It's down. Yeah. Not a lot of up. No. Not a high side. No. So, and there are two types of depression that are out there. Both of them managed sometimes with medication, but the behavioral therapists, they're very helpful to getting you where you want to go. Actually, if you look at depression, traditional, yours, and the bipolar depression, yours has more of a history, a family history associated with it, bipolar. So I would, this is true. See, I would suspect that it's somewhere in your family you have someone, because there is some genetic, I don't know what you call predispositions. It's not like a gene that's marked. It's not that. But there is a certain history. Is your father or mother? Probably your mother's on your mother's side.
My father's side.
Your father, okay.
My uncle, he passed away a couple years ago. He suffered from bipolar disorder.
Okay.
Yeah, and my dad, he suffers from like anxiety, and I think he, like, cause I know him. I actually took him to my clinic before because I noticed that like my dad gets really paranoid and stuff like that, and like I just noticed like certain things about him. So I figured like, you know, maybe he should go see
someone.
Yeah, so I took him, and I took him about a year ago. Like he's been drinking and smoking heavily for like since I was small. And it's funny because when I took him to the clinic, he stopped drinking and smoking.
Okay.
So I knew, like, you know, he was self-medicating because I was doing that at one point. You know, drinking and smoking marijuana and stuff like that.
Right. You smoke anything now? Just to tell you, the worst thing you can do right now with a depressive mood is to put drugs in your body, like marijuana. They just make things worse. They really don't help at all. But people still do it. I mean, you know, to try and get relief, so to speak. And in many cases, they do medicate you through it. But what's important in that medicating experience is that you don't use medication as a crutch for the rest of your life. So you have to start to manage your life better. And I think the first thing I didn't expect the show to go in this direction, but okay, it's going in this direction. You do need this, both of you would benefit from like a behavioral type therapist who has, as an adjunct psychiatrist, who could medicate to get you through some stressful events. But your life expectancy is very much contingent upon your ability to take ownership of your mood and to manage your mood. It's not a runaway train, but that's the way you think it is. See, that thought of a runaway train, especially in bipolar, because you wake up one day and you're woohoo, you know, and then the next day you're all the way down here.
You won't get out of bed.
And you can't get out of bed, and so you won't wash, you won't get, you don't shower, right? You don't do anything. You don't take care of your hair. You don't nothing.
Right.
See, and then the next time you're going to the beauty shop 10 times.
Or
when
going
you're manic.
shopping.
You know what I mean? You never stop. You're getting massages. You're doing, you know, all kinds of
My
things.
thing is just buying clothes. A lot of times when I feel horrible about myself, I'm like, maybe I should go buy a pair, buy a pair of jeans or a shirt. And it's funny because I have so much clothes in my closet with the tag still on it. And I still feel like I need to go buy something because I have nothing. But I still, you know, so that's one of those things that I came to realize, like, you got to slow down. Before, like, when I was younger and I wasn't aware of what was going on, I would spend money like it was nothing, you know.
Blow that credit card.
Exactly. But now I'm, you know, even with the bipolar and the urge and the, you know, the compulsiveness, I'm being older and being experienced helps me, like, stop for a second, just think about it, even in the midst of everything going on.
So we have these kind of two different views of your mood, however we want to look at it. How's that affected your ability to be successful in college? I mean, did it have an impact on your college life?
I think it has. Like, for me, it has. Like, sometimes my performance isn't the best. I know I miss a lot of school because like it's hard for me to get out of bed sometimes. But one thing that I did do was take control of that by going to I registered with the student disability office. So it's kind of like I had them to back me up. So if anything happens, you know, I had like documentations to let my professors know what I'm going through. So that's kind of like my way of coping it through college, just to have that support system.
Okay. How about in your case?
Well, I mean, I started off in CCP like really bad. I would miss class. I didn't have a drive. I didn't have a vision or goals. I just didn't know what I wanted to do. But it's funny how she said support system. I felt like my support system was kind of like being more involved within school activities, and I joined like the school newspaper. I feel like that was a support group in itself, just because it gave me some kind of motivation or some kind of goal to have for myself, like personal and my future, and I didn't see it so bleak, you know. And it was just being involved and volunteering and just putting my time into things that won't keep me alone or isolated in my room, just with my thoughts. I think that helped me a lot.
Did it help you, when you say it helped you a lot in college, did that filter into the rest of your life where you started to say, well, I have to do more things to get over my mood?
Yeah, that's actually, it actually has. There, you know, like, I do that. I mean, like, I just understand that I can't be alone with my thoughts sometimes. So there are times where I have to just get out and do something, like whether sometimes read or outside or something, just get out of my head.
Did you meet any close friends when you were in college that maybe you know, were supportive of that, or did you join you know, a support group that was related to the college that might have been helpful while you were here, or just or anything like that? You say you were in the newspaper and other.
Yeah. I also did, I mean, not CCP related, but the G-Town radio.
Mm-hmm. Yeah, that helped out a lot too.
Oh, okay.
And another volunteer organization, like for community, it was called the Latino Partnership Leadership, like leadership group type of thing. I don't know, it just helped me kind of understand that, like, I can help the world in some form.
Yeah, it's something about the power of giving.
Yeah,
Kind of empowers us in a way. So did any of the depression or the bipolar, did that extend the 2 years? Were you both in school full-time or part-time?
When I started, I was part-time, and then I did full-time. Like, it would depend on what's going on in my life during that semester. Sometimes I would be part-time, sometimes I would be full-time.
And that would be related to how your mood was? You think,
not
or
just
not?
my mood,
okay.
Like if I was working at the time,
okay.
or, you know, things like that. It would vary. Like if I had other stuff going on, I would go part-time. Like just last semester, I was working like in a field that I was, you know, it was a lot. So I ended up only taking 2 classes because, you know, it was hard to balance the job, school, and, you know, because at the time I wasn't taking meds because they made me sleepy, and it was like, if I take the meds, I might not get up in the morning. So while I was working and going to school, I wasn't taking my meds. So it made things that much harder to balance.
And the medication probably would affect your ability to study. You say your concentration.
Mm-hmm.
So the college experience had an effect on you reducing non-medicating experience, I would think.
Wait, I'm sorry.
Well, it sounds like in order for you to study, if you were on your meds, it was difficult.
Yeah.
So therefore, you probably either talked to your psychiatrist or whatever, and had them reduce it or curtail it so that you could concentrate on your studies. I would
Right, so my question is, did you kind of just stop on your own, or was it through a doctor that you kind of weaned yourself off or came off of the medication?
I'm actually still on medication now. I don't take it like consistently like I'm supposed to, but I am prescribed medication for the depression and the bipolar. But I feel like sometimes I want to like try to make it without having to be on medication for the rest of my life, you know. So that's why sometimes I just don't want to take it.
So it seems like, and again, from my very lay red chair over here, that should still be managed through the doctor by letting the doctor know my goal is to come off of this. What can we do to work together? What can I do, as Dr. Scholes said, from a behavioral point of view, versus trying to manage that yourself.
Yeah.
See, the key to lowering meds if you're in school is the fact that you have new coping skills. You have new ways of dealing with the world, so that whatever was stressing you out is minimized and therefore doesn't need to be medicated.
Right.
But without new skills, you just are creating a vicious cycle. Now, interestingly enough, college gives you skills. So the expectation is that as you go along, your self-esteem increases because you're now a college student, you're a college graduate, and therefore that increases your self-esteem, which could have a very positive impact on other aspects of your life.
I definitely agree, because I feel like school has always been like that light at the end of the tunnel. You know, like when I start doubting myself, I'm like, you have an associate's degree. Like if you could do that, you could do anything you put your mind to. So when I start doubting myself, that's what keeps me going. Like you're in school, like, and I'm walking in May. So, you know, things like that help me when I'm doubting myself or feel like I'm not good enough.
You're walking for your bachelor's. Yeah, so that's definitely something.
Yeah.
Well, that's why education is a wonderful thing, because it does increase your self-esteem. Because now, you know, you could be all the things you are, but now you're educated. You know, you have a degree, and in this culture, that means something to have a degree, and so it should elevate your self-esteem. And I've often said that about students who are here at the college, that, you know, you might have had X experiences as a college student, and mood or drugs or whatever. But the mere fact that you're completing a degree shows that you have worth and value, and that'll surely help you around mood. Does that make sense to you too?
Yeah, it does.
Yeah, you know, it's a kind of an interesting way of looking, like as though education is therapeutic.
It is.
You know, it has that kind of therapeutic quality to it.
Yeah.
And did either of you find other students who suffered from something similar, or anything, peers in your classroom, or just folks who went through depression or bipolar or something? Or was it something that just wasn't talked about?
In school, I never met anybody, because I never talked about it with my peers. I never developed a relationship with anybody close enough to tell them what I'm going through. So I never really had anybody I never really had a support system in school besides the disability,
Center for,
the Center for Disability. But last year I was going to it's called IOP, Intensive Outpatient Program.
Was it 8 or 10 hours you were in there?
Yeah, it's like 3 hours for like 3 days a week. So, and I was meeting people, like, but it was harder because a lot of the people, like, I was coming from a different walk of life from the other people that was in, you know, in the group. But I did meet somebody that was, you know, on the same page as me. He was going to school and he was, you know, battling bipolar and stuff like that. We became friends. So, yeah.
I know that in the counseling department, they did start a group, like a depression awareness group, I know, in the college. And, you know, one would suspect that there needs to be more of those kind of almost self-helpy kind of groups on campus, more than we have, so that you could gravitate towards it. You know, we have a recovery group that meets on the campus, and we should have a mood group, a woman, you know, they are on campus. There are some of them, but for some reason, they're not as publicly known, or there's still a stigma associated with, even though we tend to think of ourselves as being very liberated in schools, you know, in colleges, there still seems to be a stigma about, you know, getting together with other depressed people to talk.
Right.
I mean, don't you think?
But there's value in, again, my history of domestic violence. I still remember 35 years ago going to the shelter and getting there thinking, it's not just me. It's not just me. Look at all the rest of these people who are going through that. So when you connected with this person, that you feel that kind of, it's not just me. And I'm sorry, go ahead.
Oh, no, I was just gonna say, and like he was going to school too, and he was, you know, he was like doing good. So it felt like, and like, but because I felt like it was like when I was in the programs, it would be like a bunch of people, like just getting, you know, just getting over drugs and alcohol, and I'm like in school, and like it was just it was hard to connect with them, you know. But with him, it was kind of different because we were coming from the same place. We were trying to better ourselves. I mean, they all were, but you know, he was in school, and I could relate with him more because I felt like we was more on the same page.
Was the support in that relationship, was that you kind of, was it relating, kind of helping, oh my God, finally someone who understands what I'm going through, and did you guys support each other with, today's a bad day, today's a good day? So what did that relationship look like?
Yeah, it was definitely like that because when he needed somewhere to stay, I let him move in, and you know, and we were each other's support system. And something happened, he moved out, and the person he lived with didn't know what he was going through, because you know, like it was different because me and him was going through the same thing, but she had no idea what he was going through. So it was hard for him to like. She ended up kicking him out because of the situation, but because I know what it is, you know, it was easier for me to tolerate, you know, some of the things that he would do and stuff like that, because I was coming from where I know, you know, like what he's going through and stuff like that.
So do you guys think if the college did have some kind of a group, kind of folks who are going through depression or have bipolar disorder, do you think that would have helped you kind of as you were going through?
That's kind of an interesting story, because if you look at the college experience, they exist here, but for some reason they don't seem to be filtering down close enough to the people where they could feel comfortable enough to come forward and join those groups. And I think what needs to happen is more diversity of groups need to be on campus, so that, you know, you could kind of join 5 or 6 of them and make the student life more reflective of the life of the community, which I think it continues to be a concern I have at the college and others have. And although I know that the counseling department does have groups because they've talked to me about them, but for some reason, it doesn't seem to filter far enough, and maybe because they need more of them. I mean,
maybe they're not filtering, or maybe there's a stigma that's kind of attached.
Well, there is
to
a stigma. You know,
that I
there
want
used
to
be a heavy stigma toward addiction, and that's kind of like changing slightly. But the addiction toward mental health concerns on campus, they talk like they're okay with it, but you know, people want to know, where's that room? I don't want to go in and say, oh, this is the room where the depressed people meet. You know what I mean? They want to call it something else, maybe a peer support group. Or, as they say in the city, certified peer specialist groups.
I've actually thought about being a certified peer specialist, but I haven't really gotten into doing, you know, the certifications and stuff like that. But I think one of the best ways to reach people would be like probably social media. Like if you could get them talking on social media and getting comfortable with each other, because it's easier for people to like let out their feelings on social media and stuff like that. So I think if CCP was to like start a page on social media and then have all those people come together and then say, okay, well, why don't we all meet in person and stuff like that, I think that will probably bring a better result, because you know, you're getting to know these people through social media, and at the same time, it's like you're more comfortable with being more yourself, or like, you know, letting go and letting your guards down and stuff like that.
Yeah, it definitely happens on social media where you feel more freedom. It's almost as though you're behind the curtain. So people tend to say more.
Even people say things to you on social media they would never say in front of you.
Exactly.
I mean, you do get that too, where you say, "Wow, that person's pretty ignorant." I mean, you know, talking to me like that.
Right, right.
But in front of you, when you meet with them, you say, "Well, I need to meet with you." They're nowhere near that. Whatever it was that precipitated the discussion. So yes, so expanding the concept of social media to deal with all kinds of concerns, and in this case, mood, would be very, very helpful. Now, I often wonder if that occurs here. I'm not familiar with it. Now, maybe something is going on, but I'm not.
I could look it up. I mean, go on Facebook and see if they have any.
But I mean, when you were here at the college and you were here at the college, you don't remember coming across that, and that wasn't that many years ago.
Yeah, I graduated in 2012, and I don't remember having anything like that, like, you know, peer support groups and stuff like that. And I think it's important, just not just for mental illness, but just in general, because, you know, when you have finals and midterms, everybody is just like, you feel like you have a mental illness sometimes when you're going through, because it's just so much going on. So, you know, I feel like they, you know, that's one of the things that they lack is those support groups, even if it's just to talk about what you're going through as a college student, or, you know, if you want to talk about your disorder and stuff like that. But I don't know, I think it's just, you know, getting it out there to the audience and letting them know that stuff, there is those type of things out there where if you need, you know, if you need to talk and stuff like that, you know, you have people to support you.
Right, and if you want to talk, and it's okay, because you're already going through puberty, and then you're coming from high school, and you're going to college, and all of a sudden now, if you don't do your work, there's no one saying you didn't do your homework, you don't do your work, you just get an F. So it's that independent, so you are going through a lot. I mean, folks are like, I can't wait to get out of high school, but once you get to that point of being an adult, it's a lot to manage. And I know we talked about having, we talked to Marsha about having, meeting someone when they were going through the college years who was also going through something similar. Did you experience that as well, Keisha?
I mean, I've experienced, like, I've met people who went through different things in life, and I mean, they weren't necessarily going through depression or mental health, not that I know of, but it was kind of inspiring to know that people are still, I mean, you can meet people that are going through so many different things and they're still coming to school and they're still trying to do, you know, better with their lives. Right. So that was kind of inspiring for me. And a lot of students actually inspired me to do better in school and get better grades. Because, I don't know, it was just, even though we kind of didn't, you know, ever talk about like mental health or anything like that, it was, you know, you kind of see the, like we kind of discussed like our lives and what we're going through and that sort of thing. So I felt like that was very inspiring.
Yeah, it's something about sharing that and realizing it's not just me. I'm not the only one that's different over here, and everyone has this white picket fence kind of life. Right. Then when you hear people's story, you go, wow, we all have a story. Right.
It's like humanizing the shadow, they say. You know, it's like a way of finding out that your thoughts are not just your thoughts. Other people have those same thoughts. And in that sharing of thoughts, there's a kind of a feeling of comfort. About that you're not the only bipolar person at the college, and you're not the only depressed person at the college, you know, and you find other people who have similar experiences and they're here supporting their education. So it makes it easier to live here because you don't feel unique and separate, because what happens with people with a variety of health issues is that they tend to see themselves as different from everyone else. And what we want to do really as a college is to find our common ground. I would say that generally about what college life is supposed to be. It's supposed to find the places where we can find common ground to be with each other and let our difference be not what separates us, but what brings us together. And you see that with a lot of topics, races, a variety of topics you would see that with.
So here's something, and it might be a little bit to the left. So in high school, there's lots of different reasons why students come to CCP. I would think that a lot of traditional going away to a four-year college, there's other things that are happening in their life that send them to CCP because they're dealing with some things on the outside versus going to a traditional from high school, going away to on-campus college. I thought about that and listening to both of your stories, and when I came to CCP at 17, there was definitely a lot going on in my personal life that was crazy, it was, that was going on, but CCP was that I have to try to find this one thread that I can hold on to that despite all the rest of the chaos, I can kind of climb my way out. So it seems like maybe in that admissions process or somewhere in there that the school acknowledges that. I'm not sure if they do.
I think it does.
You know what I'm saying? To say that a lot of people are coming from troubled or different kinds of backgrounds that need support.
I've often thought, I mean, I've been here for over 40 years, teaching, and I've often thought the beauty of community colleges in general, and in particular CCP, is that it gives people a first opportunity, an experience that there's no, you don't have to have an SAT score, you just, have to come and try. And through that experience, you move forward. So it's a real, I call it, it's an experience of working parents, if you know what I mean, where many parents can't afford to send kids away and put them on campuses all over. And some people who come here, already have children and have a life.
Right.
I mean, they just can't pack up and disappear.
Right, right.
So it does give people that kind of opportunity. And I think that's one of the beauties of at least I believe, of community college. And it gives you an opportunity to become an educated person and then catapult from here into other institutions like Temple. And hopefully find a place where you can manage some issues. We have a lot of developmental courses. We have a lot of things to help students move forward. I think what you're saying, what I'm hearing, is that we need to have more behavioral health, mental health support systems embedded more into the college. Now there are some here, and I don't want to negate what the fine work that's going on in the counseling department here and all that. I think that is an issue that needs to be more addressed in the sense of what we're trying to do. Does that make sense?
Yeah.
I mean, if you looked at an ideal community college for the issues that you were just talking about, mood, etc., what support networks do you believe you would love to see? As just an idea. What would be something that you would say would be helpful to you when you entered here and would have been more facilitative of you moving forward?
I think having staff that helps the students deal with the pressure of finals, because a lot of times kids during finals, a lot of students go through a lot mentally, and me being bipolar is hard for me, but even if I wasn't, going through those times where it's really rough, I feel like just having that support system where, kids could come in the room and say, okay, this is stressing me out, that is stressing me out, or whatever. And amongst each other, maybe even help them, with whatever they might be going through.
More of those kinds of groups, like at the Center for Disability or in the counseling department.
Yeah.
There are some of them already, but yes, maybe a little bit better outreach to students around it.
And I think they should be, like I was saying, the social media output. I think that would really help, because a lot of people they're not comfortable with face-to-face, or they're not comfortable with just coming out right and telling their story. But if there's a Facebook page where they can vent, and people comment with each other and talk each other through whatever they might be going through, that would really help too. I'm not sure if they have, if CCP has.
When you were here, you didn't recognize that there was such a thing going on.
No. Yeah, so I guess kind of embedded within the whole university experience, the self-care, kind of taking care of self, making sure that finals were coming during this time, make sure you hydrate, make sure you get some sleep, just that kind of stuff. And it seemed like just that kind of assistant would maybe open up the dialogue for more people to kind of reach back and say what's there.
And the advising system is changing now at the college to integrate more, where you would have like an advising counselor that would be more facilitative of those kinds of things too. How about, does that make sense to you? Or do you?
Yeah, I mean, I would kind of want to see more of like a relief type of group where it's not necessarily you have a group like a stress relief kind of group.
Sometimes refer to them as psycho-ed groups, like, so that we don't say they're therapy, you know.
I don't know.
I don't know if that's what you're talking about, where you can come in and chat.
Yeah, I'm not sure, or play icebreaker games or something. I don't know, like something where it's not so serious in a sense, you know.
But it sounds like you're saying, but they know that they're going in there, whether it's throwing racquetballs or doing something that they know they're going in here to dump stress with, which means to do that, you have to acknowledge that you are going through some stress. I'm going to go in here because they have these short activities that allow me to go in before my next final in 20 minutes or 30 minutes and do something that's going to help dump some of that.
It's funny because Temple actually has this thing where around finals they bring out these dogs, these therapeutic dogs for the students, you know, just to have them around and they pet them and stuff like that. And that's supposed to help them with their stress, you know, with finals and stuff like that. And I thought that was pretty cool. So, I mean, because a lot of times it might not be meant, you know, like you might feel like you're going through anxiety or depression, but it could just be, you know, what you're going through at that time because of everything you're going on in your life. Not to downplay mental illness, but a lot of times, you know, even just having somebody to talk to, you know, and just say, yeah, I know, like, you know, we have a final next week and I don't know what you know, like, and just vent and just let it out. Or, you know, for the students that do suffer from mental illness, just have that circle where, you know, you have people that understand what you're going through and can talk. And you can, it always helped me listening to other people's stories.
Right.
Because then I'm like, yes, that's exactly how I feel, you know.
It takes that isolation away. Exactly.
Yeah.
It's almost like you have to build in a lot more supportive networks around the whole student life. And I mean, and I'm not demeaning what's going on in student life, because I think they do a wonderful job here in the sense of their experiences. But what you're saying is that there needs to be more of it, especially for people who maybe have behavioral health challenges like depression.
Yeah, and even if it's just like letting them know where it's already out there, because I feel like a lot of times, you know, you can't seek what you don't know is out there. You know, if you don't know that these programs are out there, how can you, you know, like it's no use in having a program if it's not reaching the people. You know, it's all about, like, you know, trying to reach those people that need those programs. You know,
and that's why I think it's so wonderful for both of you to share your story, because people are going to see this and go, maybe I will go check out that program. Maybe I will go there. And break that stigma to see someone else doing it. It goes, hey, I relate to that.
Based on your student experience here at community college, what would you recommend that the college do, just based on your experiences about people not reaching you? What would you think?
I think
the social media one, I know you said that one, and I think that's a good suggestion, actually.
But like the programs that are out there, I feel like, you know, we should, you know, try to reach the people, let them know that they're out there. Even if it's, you know, having flyers or sending them emails like, you know, hey, are you stressed? Like, join our support group. You know, having those complimentary,
like
like the group emails, like, hey, you know, if you're feeling like this, you know, we can all meet up in room such and such. So then they know, you know, instead of like just having this, you know, if you have a group but nobody knows about it, it's like, you know, because if I'd have known about a group in CCP, I would have definitely went.
And when you say group, do you mean like it has to be a part of the social organizational fabric of student life, or just a group, you know, like that just happens to go into a place and talk?
Well, I mean, a group that, you know, you can relate to. Like, may it be a group for kids that are stressed out about finals, or if it's a group for kids that might be feeling depressed and trying to get through the semester, you know, stuff like that.
I don't think it's necessarily unique to, we keep referencing community college of Philadelphia, but I think it's not unique just to community.
Right, no,
it's
yeah.
Temple, it's Drexel, it's
Right.
St. Joe's, it's South, all those schools. I mean, these are common problems. They're not just, I think,
Right.
unique to us, but I think is an event that's stressful for most students.
Yeah, I just recently got a email from the Student with Disability Office from Temple, and they're trying to get, like, you know, a group they're trying to get people to come together and talk and stuff like that, you know, and their way of reaching out was through like emails and stuff like that. So I think that's a good, you know, way of reaching the students. Like, you send emails for everything, so, you know, you could just say, hey, you know, this group is happening, we're located such and such, and just let them know that, you know, that support is there.
So it seems like, I'm pretty sure all colleges have a behavioral health or counseling therapy center. Were you guys both aware of that at CCP or at Temple where you're at now?
I'm aware of it at Temple,
right.
but not. And the reason why I became aware of Temple is because I actually had a professor, and I was really, really going through it during that semester, and I told her. And she told me, like, you know, you should register with the Student Disability just so you can have them to back you up. And that's what I did. And because I'm registered, I get the emails from them, you know, saying, hey, you know, they might email me for scholarship for students with disabilities, or they might email me, like I said, about the group that they're trying to bring together. So
yeah, you said that you did connect with our Center for Disabilities, which is a fairly well established. I mean, over the years, I know I've dealt with them a tremendous amount of times, and they're pretty integrated into the school. But again, there's always a need to enhance those services and bring more things to bear. Does any of this make sense?
Yeah, I actually think one of the things that she just said, that her professor actually came to her and you know, you got to talk to your professor, and she recommended that you see this group. I think that if professors, you know, see something, you know, wrong with, I think that would definitely help, you know, to not only show that student that, hey, this professor, you know, cares, but that there's also a way to deal with your problem and try to do better in the class. Or I think that's really important. I don't know.
So it seems like
more personal.
Right.
It's more personal.
And like try to be more aware of what's going on with the students, because they might be too ashamed to tell you, like, look, I'm really struggling. Like, you know, just noticing those signs. I think, yeah, like that's what you're saying, like noticing the signs that those students need help. Yeah, I think that's a good idea.
I've had meltdowns in classes, you know, and I never had a professor tell me where to go or who to see, and sometimes I kind of wish that would have happened. Maybe it would have helped me a little bit more, but
well, it was interesting kind of dialogue about the mood and community college. And I want to say that both of you were. What was your major when you were here? Just out of curiosity.
Well, I switched so many times.
Oh, okay.
I started off writing liberal arts, then mass media.
And your major was?
Liberal arts.
Liberal arts. Well, that's all the time we have for today. I want to thank my guests, Marcia Hilaire and Keisha Lagoa, and my co-host Renee Norris-Jones for joining me today. I also want to thank you, our viewers, for tuning in. You have been watching the Tapestry of Life on CCP TV, the educational channel of Community College of Philadelphia. I am Dr. Pascal Scholes, Professor of Behavioral Health and Human Services. See you next time.